Good afternoon. In today's video demonstration, I will going to demonstrate the routine procedures of the scapula, namely the AP projection of the scapula and the lateral projection of the scapula, or also known as the scapular Y. Good afternoon, ma'am. Please sit down po. By the way, ma'am, I am Jonah Pulgo Ikoy and I am your rad tech for today. Mangutan ako, ma'am, what is your language preference?
Bisaya po, sir.
Noted po, ma'am. Ma'am, mangutan ako, ma'am, ha, for patient confirmatory ni ma'am, if
Opo.
tama ba akong patient karon. Yung pangalan, ma'am, is Stephanie Ann Pulgo Ikoy.
Yes po, sir.
Date of birth niyo, ma'am, is August 3,
Opo.
2003.
Opo.
And your age today is 17.
Opo.
Okay. Then, mangutan ako, ma'am, if pregnant ba ka karon?
Dili, sir.
Dili. Kano sa ka last gidugo, ma'am?
Last month po.
By the way, ma'am, tama ba ko, ma'am, na sa ano ni ma'am, sa scapula ni mo, ma'am, diri sa likod,
Opo, sir.
kaning
Sa-
left, right,
sa
ma'am, no?
Sa
Right?
po.
Okay. Then, kaya malihok ni mo, ma'am.
Opo.
Dili kay siya sakit.
Sakit siya, sir, pero malihok na.
Makaya ni mo.
Opo.
So, before ta mag-undergo sa itong procedure, ma'am, ang natay, pagano na to itong mga metallic objects, ma'am, like quintas or any na mag-superimpose sa itong image na mag-result. And then, dito ato ang dressing room, ma'am, which is mag-change ka dito og ma'am, patient gown. Then, ang pagsuot sa patient gown, ma'am, is nasa likod ang pagtali.
Opo.
Nakuha ba ni mo, ma'am?
Yes, sir.
Sige po. So, ang procedure din nato nakabutang diri, ma'am, ingon sa imong requisition form, ma'am, is duha ka buok
Opo.
kaning AP projection sa imong scapula o lateral. So, duha ni ka procedure, ma'am, ha. Kani, ma'am, mo ni siya ato ang gonadal shield. So, ibutan nato ni siya diri, ma'am, para maprotektahan ang imong ovaries kay sensitive na sila sa radiation.
Opo.
Sige, ma'am, proceed na po ta, ma'am, sa atong dressing room. While our patient is nag-ilis pa siya sa atong dressing room para sa iyong patient gown, the technical factors for these procedures are the following. So, we have a 10 by 12 inches na image receptor, our lead marker, right? Since ang patient is affected side is the right side. And then, the SID for this one is 40 inches or 102 centimeter. Then, we will going to use a grid for this one kay since the anatomy being radiograph is greater than 10 centimeter. 1, 2, 3, go. Ma'am, doctor, ready na ba ka, ma'am?
Yes, sir.
Sige po, ma'am. Ato na diri ang manang sa ato ang vertical pin. Ma'am, right side to, ma'am, no?
Yes, sir.
And position ka, ma'am. So, today we're going to first demonstrate the AP projection of the scapula. So, in patient positioning, position the patient upright. So, the upright position is preferred compared to the supine position because the shoulder is tender for this one. Then, in part positioning, abduct the arm to the right angle to the body, and then flex the elbow and support the hand. So, ma'am, sunduga ko, ma'am, ha? Ani, ma'am. Dikit siya na, ha? Then, center the palpated scapular area to the IR approximately 2 inches or 5 centimeter inferior to the coracoid process. So, center the IR. So, the coracoid process is here. And then, inferior down, 2 inches inferior to the coracoid process. So, okay, pa-align na ito ang IR and the scapula. And then, shield the gonads. As you can see, that are already instructed the patient to use the gonadal shield. And then, the central ray must be perpendicular to the IR at the mid-scapular area approximately 2 inches or 5 centimeter inferior to the coracoid process. So, dili siya center here. So, to demonstrate the central ray, so the central ray must be centered to the IR at the mid-scapular area approximately 2 inches or 5 centimeter inferior to the coracoid process. So, our coracoid process is here, and then 2 inches, so here, center. And then, in collimation, adjust the collimation to 10 by 12 inches or 24 by 30 centimeter. Place the side marker in the collimated exposure field. So, place na to ang marker here. Make sure that it does not superimpose with the anatomy being demonstrated. By the way, center sa nato, excuse me ma'am. Okay. So, na-center na ato ang coracoid, atong scapular area to the IR. So, center na siya. Then, instruct the patient to do not suspend his breathing, ma'am. So, we need to have breathing instruction. Ma'am, exhale. Ay, mali. Inhale. Exhale. Inhale. Then, hold your breath. Then, assuming that we've already collimated tightly, then, shoot. The structure shown for AP scapula projection, as you can see, we can already see the lesser tubercle, the acromion, the glenoid cavity, the neck of the humerus, the coracoid, the clavicle, the superior angle of the scapula, the scapular spine, the supraspinous fossa here, the scapular body, the vertebral border, the lateral border of the scapula, the inferior angle of the scapula are clearly demonstrated in AP scapula projection. For the criteria evaluation for AP scapula projection, the anterior and posterior margins of the glenoid cavity are nearly superimposed, as you can see on the radiograph. The lateral scapular border is seen without thoracic cavity superimposition, while the thoracic cavity is superimposing the vertebral border, as you can see here. The superior scapula angle is seen without clavicular superimposition here. The scapula is demonstrated without longitudinal foreshortening. The superior scapula angle is slightly 0.25 inch or 0.6 centimeter inferior to the clavicle. The mid-scapular body is at the center of the exposure field, as you can see here. The scapula is included within the exposure field. Then the scapular structure situated in the thorax demonstrate adequate contrast resolution. The next projection that we are going to demonstrate is the lateral of the scapula or the scapular Y. Then the affected side of the patient is right. So, in patient positioning, position the patient prone or upright. So the patient here is in upright position. Okay, it's much preferred compared to the prone position is because the shoulder is standard. Then the technical factors in this procedure are the same with the AP scapula projection. Then in part positioning, place the patient in an oblique position of about 45 to 60 degrees and centered the affected side of the scapula to the IR. So, ma'am, position ta ka, ma'am. Bulit ko, ma'am. Anak, ma'am. Huwag ganat, ma'am. Dikit yung anak, ma'am. And then, extend the affected arm across the anterior or posterior thorax or above the head to show the appropriate portion of the scapula. So, ma'am, magulit ko, ma'am, ha? Kamot lang. Dikit, ma'am. So, then palpate the medial and lateral borders of the scapula and adjust the body rotation so that the scapula is in lateral and it's projected free of rib cage. So, impalpate the medial and lateral borders of the scapula. So, medial here, then the lateral borders are here. Then, centered, make it sure that the scapula is centered. Wait lang, ma'am. Iba na ito naman. Okay. Centered na siya dikit, ma'am. And then, do not forget to shield the gonads of the patient. Then, the central ray must be perpendicular to the IR and position the medial border of the protruding scapula. So, here. So, the central ray must be positioned to the medial border of the protruding scapula. So, the central ray must be located here. So, to demonstrate the central ray, again, the central ray must be perpendicular to the IR and positioned to the medial border of the protruding scapula. So, this is the medial border of the protruding scapula. So, center the IR here. And then, collimate, adjust to 12 inches or 30 centimeter in length and 1 inch or 2.5 centimeter to lateral shadow. Then place the side marker on the exposure field. So, place the side marker and make sure that it does not superimpose with the anatomy being radiograph. Then, you can also use a compensating filter to increase the image quality. So, assuming that we've already used the compensating filter for this. Centered, ma'am. Ma'am, pakigunit ko ano yung isa, ma'am. So, yung buhok para dili siya mag-superimpose. And then, for breathing instruction, instruct the patient na, ma'am, inhale, exhale, inhale, hold your breath, ma'am, and then expose. And the structure shown for the lateral projection of the scapula, or what we call the scapular Y, the most prominent we can see on this in the lateral scapular projection is the scapular Y. So, nag-form siya og Y ang scapula here. So, you can see, so the structure shown for this one is the acromion process are clearly demonstrated as well as the coracoid process. The humerus, the body of the scapula here, or the mid-shaft of the scapula, the inferior angle of the scapula are clearly demonstrated. So, for the criteria evaluation for lateral scapular projection or the scapular Y, the superior scapular angle and the clavicle are at the same transverse level, as you can see here. The scapular body is in the lateral projection and superimpose lateral and vertebral scapular borders. As you can see here. The scapula body and thoracic cavity are not superimposing. As you can see here. The mid-scapular body is at the center of the exposure field. As you can see on the radiograph. The entire scapula is included within the exposure field. Ma'am, dahil na po ang ating procedure. And then, pwede na ka mag-ilis, ma'am, sa yung pakihanger na lang po sa patient gown, ma'am. And then, the result will be 2 to 3 hours pa po siya, ma'am, bago makuha. Okay lang ba, ma'am?
Okay lang, sir.
Thank you kayo, ma'am, sa
Thank you,
cooperation.
sir.